Hello, everyone. Welcome to the webinar. I'm really glad you could make it, and I hope you'll find this very useful. I am Sylvie Kilford, and I am the Programme Coordinator for the Leicestershire Healthcare Inequalities Improvement Doctoral Training Programme. And with this webinar, we hope to give you an idea of what this program is about, what its aims are, and also give you some helpful tips and hints on how to improve your application, how to write a brilliant CV and an effective personal statement, and how to do well in an interview. So you will hear two speakers today. You will hear our program director, Professor Sally Singh, and our co-director, Dr. Claire Lawson. And while you're listening to their presentations, you can type questions into the box on your right, on the right of your screen. We will answer questions at the end, so but you can write them whenever you feel like you have something that you'd like to raise. And yeah, so let's just jump right in. Our first speaker is Professor Sally Singh, and she will talk to us about the program and its aims and processes. So over to you, Sally.
Welcome, everybody, and delighted to have a number of you with us today. And as Sylvie said, we're going to divide this into sort of two sections. So I'll speak first and then Claire, looking at, I'm going to set out the structure of the DTP and some of the ambitions for it, so you can begin to understand how applications fit into that and how we, on this occasion, selected projects that we advertised on the website for you all to apply to. So as Sylvie said, our abbreviated form is the LHIIP DTP, but of course that stands for the Leicestershire Healthcare's Inequality Improvement Programme, which is part of a Wellcome funded doctoral training programme. Now, we had some really very broad ambitions, but we had some very key partners that sat within Leicester and Leicestershire. So the University of Leicester is the host university for this DTP, but we are partnering with Loughborough University, who historically we've partnered before academically, particularly around biomedical research centres. But importantly, we have our clinical partners on the application who are fully supportive. So that is our local acute trust, but also the local primary care networks and primary care trusts. And from a public health perspective, we've also secured the support and commitment from Leicester City Council. And all of us have this, essentially this shared vision to reduce health inequalities. So that is absolutely the thrust of our programme, to really improve the care of people with multiple long-term conditions, so that their opportunities to receive healthcare are enhanced, and potentially healthcare programmes may be adapted to particularly suit their needs. Many of you will know that Leicester is a truly multicultural city and county, and so we feel that we have a very rich environment in which to work and address some of these challenging areas around health inequality. So our vision is really to create this vibrant and supportive, interdisciplinary and flexible training programme to really attract underrepresented healthcare professionals and become a beacon site for nurses, midwives and allied health professionals, to support them to become leaders in research nationally and internationally. And we know that of course, a lot of medical staff have the opportunity to continue research, and perhaps a few more funding streams that might be available to them compared to nurses, midwives and allied health professionals. But we really want to put Leicester on the map in terms of being this beacon site for research training for allied health professionals, nurses and midwives. Now, this was one of the questions that we were asked a lot in the run up to this, and all of you were selected because you were a nurses, midwives, an AHP, or indeed a junior doctor. And the junior doctors that can apply can be either from primary or secondary care. But I thought it was just worth reminding everybody in case you have conversations subsequently about this doctoral training programme, about what allied health professionals are. And this is an infographic describing the range of allied health professionals. Now, you'll note that pharmacists aren't on there as an example. And we very specifically chose to focus on nurses, midwives and AHPs. So we understand there are some challenges around certain groups being excluded, but we wanted to create cohorts of people that had professional similarities. So we've restricted this doctoral training programme on this occasion to this group of AHPs that you can see, nurses, midwives and junior doctors. We are not prescriptive about the number of professions that we recruit. We would ideally like a mix, but we're not committed to that. And equally, there are no predefined rules about the number of nurses, midwives, AHPs or junior doctors that we should recruit into each cohort as the years go by. But obviously, you know, the thrust of it really is to give people opportunities where they might not have been obvious to them in the past. So we want to recruit people that find it difficult to have opportunities to do a PhD. So in terms of the subject areas, this was the infographic that we submitted with the bid. Now, many of you may know that clinical medicine is rated very highly in Leicester, and in fact we came second in this year's REF. And these are the clinical areas that we broadly excel in. So that would be cardiovascular with a focus on obesity and renal disease, respiratory disease, and alongside that infectious diseases, diabetes and lifestyle, and cancer. But what we were really hoping for was a combination of potentially different methodologies being employed within one project. So many of you may have recognised this in the projects that you've applied for, that they will have had a combination of patient-centred methodologies in combination with, for example, with digital health or some experimental medicine with, again, behavioural studies. And we thought that this presented a real opportunity for the groups of people we wanted to select to be exposed to a whole variety of methodologies that would enhance their research training and ultimately address a number of important inequalities in these areas. So in terms of the project selection, we obviously had the framework that I've just described to you, and we put out a call to academics in Loughborough University and Leicester University to submit a project. Now, of course, importantly, these had to be within the clinical scope that of course reflects the expertise, be it research or clinical, of the University of Leicester and Loughborough University staff. So you might note, and I know that I'm a physiotherapist by background, and of course many physiotherapists are interested in musculoskeletal type projects, but we don't have a strong background in MSK research in Leicester. Now, of course, it can be intertwined in terms of managing multimorbidities, but it isn't a specific focus of this doctoral training programme. Importantly, the project selection had to address an area of health inequality, and it had to clearly articulate that. And of course, the project had to be suitable for a nurse, midwife or AHP, or a junior doctor, be it in primary or secondary care. Once these projects were submitted, we had a review process, and each project was reviewed by 5 or 6 different academics, and we had a pro forma that allowed them to score each project individually to allow us to really objectify how we were making the assessments of each individual project. And this was some of the criteria that we used. Now, obviously, the first one is pretty obvious. Does it fit with the overall programme of our doctoral training programme? Does it offer this intersectionality that I was talking about in terms of methodological approaches for the fellow? We then considered the track record of the supervisors that were putting forward the project and overall the scientific quality of the project. And also we wanted to try and develop early career researchers within Leicester University and Loughborough University, because often they don't have the opportunity to supervise PhDs, and it's a huge learning experience for less experienced academics. So not only were we trying to address inequalities for the applicants and the research project, but also really encourage the opportunity for junior researchers. And then really it did have to look at collaborating across disciplines. Now, moving forwards, we're proposing to have almost a type of a hackathon event. Now, this year's project submission was quite time limited, but obviously moving forwards, we're going to have much more time to do this, and we're going to put together a hackathon that is going to be supervised by experts within the university. And this is just an example of a project that might come out of that, where we identify the health challenge and then look at how we may address that health challenge using different experimental approaches. So you can see that clearly for everybody, multimorbidity is a huge health challenge, but you can see how you might tackle that differently with a data science approach, experimental science approach, where you might want to look at phenotyping of muscle structure and function. So that would be a very experimental methodology, and looking at social science and people's experience of multimorbidity across our ethnically diverse population. So in summary, we hope that the DTP is going to be a huge opportunity for cohorts of fellows to embark on their PhD research journey. And at the core of the Wellcome Fellowships is really this idea of cohort building and supporting others. So we do want some relationship between the projects, so that even if that's the methodology that's been employed or the topic area, so that the cohort that we recruit actually are able to bond very quickly. And just to reiterate, the University of Leicester has a real ambition to become a beacon site for training for nurses, midwives and AHPs, and I think we're seeing that in the School of Physiotherapy and the School of Nursing, beginning to shift their focus gradually to a more research-based culture. And we have strong support from across the sector, particularly our clinical partners, that we hope will form a very strong foundation for this to be an effective and very productive DTP for everybody that's involved. Thank you.
Thank you, Sally. So next will be Dr. Claire Lawson, and Claire will talk about how to enhance your application, how to write the most effective CV and personal statement, and how to perform best during your interview. So yes, over to you, Claire.
So I'm Claire. I'm an associate professor and a nurse by background, actually, and also have experienced this fellowship route. And I'm here really today to talk to you about some top tips really for your application process. So for this Wellcome Trust Fellowship, we asked for the application process for two things. First of all, it was a CV, and secondly, a personal statement. And then should you make it through, obviously, then through to the interview process. So I want to take each one of those things in turn and just give you some tips on how to really create the most robust application with the most chance of success. So I'm first going to talk about the CV and then go on to the personal statement. So when you're thinking about preparing your CV, and some of what I'm going to talk to you now is quite general, but some of it relates to the application process we experienced in this first round. So first of all, a key do is be clear, be concise, and provide a well-structured CV. That may seem quite an obvious statement, but we do tend to see CVs that can be very lengthy without clear sections. And what you need to appreciate is that a reviewer for any fellowship scheme, and also with this fellowship scheme, is that they're going to spend, between a minute and 2 minutes on each CV. So the more concise you can make it, the more bold you can make it, and the more well structured you can make it, you're going to get those key messages across without them being missed. So do present information in order of importance. Think about the role that you're applying for. This is about a research fellowship. So it's not necessarily a clinical role, so it may be slightly different to the CVs that you've prepared before. Think about the information that's most relevant to the project that you've applied for and to the role of being a PhD student, and present that information in order of importance. So there's no need to include irrelevant detail. We don't need to know about every role that you've done as a clinician. Some of that may be relevant to the project, some of it may be relevant to research, but certainly general roles that you've done throughout a career of 10, 15, whatever years, perhaps it's going to overwhelm the CV so that you actually don't get across the important messages. So in terms of content for a CV, do make it clear, do make it structured with subsections. You may use underlining or bolding just to pull out the important components. You're going to give your personal details first. Do make sure that you state your current position, where you work, what role that you do. Then what tends to be helpful is when you present a short paragraph as a brief personal statement. Now, again, this can't be lengthy because we want it short and snappy, but be concise. State who you are, state why this PhD is important to your role, why it's important now, and how it might facilitate you driving your career forwards. Then provide your professional academic qualifications, but do give the necessary details. Sometimes people will state the degree that they've done, but they won't put the level of degree they got, for example. Now, because this is a CV for a research position, next may come your research training experience as opposed to talking about all of your job roles. So in terms of research training experience, think about what you have that you've already been involved with. This may be formal or informal training. Most of you, all of you, in fact, applying for this will have undertaken an undergraduate degree. Some of you will have undertaken a master's degree. So you'll have experienced some form of dissertation in whatever format that was, which is the sort of very basic level of detail that you can provide for this section. But again, don't give sort of lots of sort of text and writing. Just think about pulling out the key components. Try and think about what research training you've had and experience and how that applies to the project that you're applying for. So again, you might use subsections, qualitative experience, quantitative experience, if you've been involved in any trials, if you've had any patient and public involvement, if you've experienced paper writing, for example, anything that relates to an academic progression or a research career, then just give that experience heads up in that CV. When talking through your employment history or you're listing your employment history, again, be concise and be relevant. So if, for example, as a clinician, you've done a number of similar roles, albeit in different areas, these don't all need listing, one after another. You can actually say, I've worked for this trust between these years, covering these range of specialities in this particular role. And that way, any particularly important employment history that you have will then stand out rather than it being overwhelmed and hidden within a long list of similar experiences. Then think about esteem indicators. So these are things that showcase you as standing out as a strong individual with whatever clinical role that you've had. So this might be membership of committees, it might be awards or prizes that you've gained. And these don't need to be huge things. It might be, a small award, it might be, your teaching excellence, it could be, an award for your clinical role, it could be a small pot of money to travel to a conference, just small metrics to show that you've engaged and you want to progress academically. And then any invited talks that you may have been asked to give, whether that's locally, regionally, nationally, etc. You then come on to any outputs. So if you've been engaged in any publications, small grants, again, this could just be small travel funds, etc. But it all shows engagement and any presentations that you've given. Collaborations, so if you've got any key collaborations, again, locally, nationally, internationally, but collaborations do with your clinical expertise, your clinical area, and, even more relevant if it relates to the project that you're applying for. And then talk a little bit about your clinical and teaching experience, but again, be concise and be relevant. Don't just give us a monologue of, all the different roles that you've done and that show very similar skills, but think about the roles that you've had and pick out the specific bits that you think will emphasize your strength in terms of taking a research independence forward. So do keep your CV to 2 to 3 pages. Now we've had CVs, it's quite challenging to get your CV down to a small amount of information, and you sort of think about what information you're missing. But again, when you consider that people will take 30 seconds to 2 minutes to read the CV, you really want the most important and relevant information to stand out straight away. So 2 to 3 pages is more than enough to get that information across. Don't produce a long, lengthy CV without clear sections, because although you may have some really key strengths and really important things you want to get across, they will just be missed within that structure. So do highlight the key areas of importance. Don't be afraid to use bolding, underlining and sections to get that important information across. And don't include irrelevant detail. So whilst you may be very excited and proud of many of the roles that you've done, just think about what's relevant. Think about what's going to make you stand out from other individuals in terms of the project you've applied for. I guess one of the most obvious statements is check grammar and spelling, but you would be surprised at how many CVs and personal statements we get through that do have grammar and spelling issues. And I think a really good tip is to think about from the perspective of who may be looking at this, the project leads. Think about what they want to see in this CV. Think about how you've got that across, and then give it to one of your peers, might be a colleague or a friend or a family member, to read that CV through, give them 3 minutes only, and then take it back, and then ask them what they think the key messages were, and see if you've managed to get that key information across. So now moving on to your personal statement. A lot of these advice or tips really reflect the similar information to your CV. So it's about presenting and preparing a personal statement that is very clear, that can be read very quickly, and that gets that important information across. So again, be clear, be concise, really well structure your CV, use headers to draw attention to key important areas. So don't write a long monologue again of the roles that you've done, because all of the good information is going to be hidden within that. And whilst it all may be very excellent and very interesting, it's not necessarily going to put you ahead of somebody else when you're applying for a research fellowship. Do in your personal statement explain and emphasise your interest in the specific project that you've applied for. So don't give general information, and don't include information that's not relevant to that role. So sometimes people will talk very generally about why they're interested in doing research, and how they think it may progress their career, and why it might be expected in their role. But really this is about the project you're applying for, because you're going to need to engage and really embrace this project for 3 years and bring your own independent thinking to it. So we want to know why you chose that project. We want to know how this project is going to feed into your own interests and how you're going to take that forward. So be very clear about why you want to do this. There's no need to repeat information from your CV unless it's directly relevant. Obviously, because your CV is going to be relatively short, 2 to 3 pages, there might be information there that you want to sort of pick apart a little bit in your personal statement, but make sure it's really truly relevant to the project, or to the becoming an independent researcher, or to why you want a PhD. But other information in terms of your clinical roles and everything else, you can probably leave out of your personal statement. And do stick to the word limits provided. Again, you've got 30 seconds to grab attention and 2 minutes for someone to read this personal statement. So make sure it's clear. So now, should you get through to the interview stage, this is going to very much reflect the things that you've put in your CV and your personal statement, but now you need to be prepared to articulate it within the interview framework. So hopefully, if you've followed the advice, it will now be very clear in your CV straight away, in your personal statement, why you want to do this particular PhD, why now is the right time, and how it's actually going to guide and facilitate and improve your future career and future direction. But you need to be prepared to articulate that, and the interviewers may try and unpick that a little bit and make sure this is the right move for you. Do demonstrate a tangible interest in the project. So again, rather than talking generally about, well, I'm really interested in research, I want to be able to do more research, I want to engage more with research, but why have you chosen this project? What is it about this project that interests you? So by the point of interview and by the point of application, you will have seen a project and you'll have named that project. So read around the subject area. Be able to talk around the evidence in your interview, and don't be afraid to bring independent thought to that project. So supervisors who are leading these projects will be very amenable to you bringing your own independent thinking. It's the very nature of doing a PhD. So if you've looked around the evidence and you've understood the topic, you might be able to then give your own thoughts about how you may take that research forward, and then let that come across in your interview. That will show real engagement. Have a clear idea of your strengths and limitations. So think about the experience and training that you've already had in research, and think about how they will help you conduct the project that you've applied for. So look at the methodology, look at the different phases of the PhD, and think about what you have already. But then, just as importantly, think about what you need to learn. You know, a research PhD is all about learning. So think about your training, but be specific. So have a look at the Leicester website, look at what training modules we do, look at what courses we do at undergraduate and postgraduate level, and think about what specific needs that you have, rather than, again, being quite general in your responses to this question. We ask you to give a presentation, a very short presentation. Do stick to time. Again, make it punchy, make it clear. Think about a research project that you've been involved with. As I said, you can always use your dissertation as an example. If you don't feel you've got anything you can present from your own perspective, something you've been involved with, then you can choose a published research study. But again, make it relevant to the project. And do give detail on methods and analyses, you know, showcase your research skills and experience and knowledge. So finally, some take-home messages. Please don't be disheartened if you've applied to the first round and you weren't successful at making it through to interview or beyond the interview phase. This was an extremely competitive process. We had over 50 applications, and I have to say that the majority of these applications were actually quite strong. So fellowships are competitive, and it takes a great deal of tenacity, preparation, and motivation to keep going. But you've got, you know, there's 5 rounds of this scheme at a minimum, so do think about applying again. But make sure that you prepare, because you've now got a year lead in to the next application. So in terms of preparation, you know, do you have any publications? If not, what could you do between now and then that could strengthen that part of your CV? You know, the advice that was given to me when I was applying for a fellowship and I had a year lead in was write a discussion piece. So these are, you know, easily accessible things to write, usually straightforward to publish. But think about how it might tie into some of the Wellcome Trust themes, so multimorbidity, long-term conditions, inequalities. Most clinical areas and specialities can relate to these issues quite well, and that would look really good in terms of a publication that you had on your CV. If not, you could think about publishing from your dissertation, or some of you may be involved in research that you could engage in publication. Think about building other metrics such as grants and awards. And again, these might be very small, you know, a small pot of money to go to a conference, a poster prize, maybe teaching or clinical awards, but think how you can start bringing those metrics together. Do think about your career and how a PhD actually contributes to your career. Sometimes people will talk about, well, research, you know, will help me improve patient care, it will help my teaching, it's expected in my role. But you can actually engage with research on many different levels in order to achieve those things. So what is it about a PhD specifically that will help your career move forward? So have conversations with clinical leadership networks, have conversations with people from whatever research infrastructure you have in the clinical role that you do, and think about what that career looks like and why a PhD is necessary. And finally, think about any training that you could do in the meantime. This could be very informal training, or it might be formal courses, a module or something on research, and gain some research exposure to strengthen that part of the experience of your CV and your personal statement. And once you know the project and you go into the application process, do speak to the project leads. They're very welcoming of candidates coming forward to have a chat about the project, read around the topic, and do get every step of the way peer reviewed. So have your personal statement and CV peer reviewed, and perhaps do a mock interview with, again, a colleague or a friend, and just make yourself in the strongest position in order to be successful. Thank you very much.
Thank you, Claire. So that's the presentation part over, and it's now over to questions. So if you'd like to ask the program directors some questions, that's your opportunity to do this now. I'm going to give you a minute. We had one question from Harry, which is whether this webinar is recorded and will be available later, and that is the answer is yes. So this webinar is recorded and it will be posted on our website, so you will be able to review this information in the future. If you have any questions to ask our directors, please write them now. And
Sylvie, should we just start the ball rolling with some of the questions and observations that might get other people thinking about some questions.
Sure. So there is one question from Amy. Shall I just start with this one?
Perfect.
Sorry.
Perfect.
Yeah, so Amy asks, when should we expect projects to be advertised for the next intake? Sally, do you want to answer that one?
So yeah, I suspect the timescales, Amy, will be pretty similar to this year. And I can't remember exactly when they were advertised. Can you, Sylvie? But the process by which we select the projects this time round will be subtly different. And we're hoping that we'll be able to involve some of the successful PhD fellowship applicants for this round into that process. So we're hoping it's going to be a truly inclusive process of developing the questions that will inform the next round of PhDs, but they will absolutely fall into the themes that we've already talked about that will align with our clinical and research expertise that we have in Leicester. So, you know, like I say, there won't be any projects, as an example, very specifically on MSK. They will all fall into the cardiovascular, respiratory, lifestyle, cancer, multimorbid themes. So they will always be in those areas, but the precise questions are going to be identified by this Co-Navigators toolkit. Sylvie, can you remember the precise dates or the rough dates would be good, wouldn't they?
Yes, so we are aiming to advertise our next project in January, so slightly earlier than this year, and have like a longer recruitment period. So hopefully we'll have our projects ready and in and advertised in January. So yes, please do check our website regularly. So all the updates will be there. And you know, this also shows your attention and engagement in the process that you do check this and review what we post there. We have another question. This is from B. If I have only completed a dissertation as an undergraduate, would involvement in a service improvement program that included data collection and analysis be useful to mention in the application? Sally, Claire? Claire?
I'm happy to let Claire.
Yeah.
Yes, absolutely. I think, you know, obviously talk about your dissertation as well, but then anything that's meant that you've engaged in the kind of research process. Now, a service improvement, you know, okay, it may not have gone through ethics, etc., but there'll be elements of it that'll be very much research focused. You've mentioned data collection, analysis, and things like that. So that shows your engagement with sort of applicable skills to research. So yes, that would be important to mention in your personal statement.
I think we're very specifically very aware that some professions and groups of people don't get the opportunity to do research projects in their normal day-to-day roles like other professions may. So I think that we're trying to be very open to being very inclusive, but clearly an applicant has to show an appetite for research, and I think, you know, if a service improvement is one way of doing that, if you have limited opportunities within your current job role. I guess the other thing to say is that we're hoping to put it on a support program to help people with their interview should they be shortlisted. For people that haven't experienced this type of interviews before, then we'll be laying on sessions hopefully to help people prepare for the interview, to give them a feel for what that might look and feel like. But we would always advise people that are shortlisted to get in touch with their supervisors. You know, I think, you know, for me, I think that always reflects well in an interview that you've proactively sought the support of your supervisor, and a little bit of initiative around that. So we do tend to view that favourably So we would suggest that in the future, if you are lucky enough to be shortlisted, do get in touch with your supervisor. I know for some people that's a bit anxiety provoking because you think everybody's a professor and, you know, might not have time for you, but absolutely the reverse is completely true, because these people want to support you and give you as much support and advice as they can to help you know, secure a PhD student in their particular area. So don't be put off. As much as you're competitive, academics are competitive to get the PhD students as well. So we will do everything we can to help PhD students get over the line.
The next question is, do I need to be employed by University Hospitals of Leicester to be considered?
Sylvie, do you want to answer that? Because you spent a lot of time dealing with HR issues. The very short answer is no, but I'm sure Sylvie can give you a lot more detail about that.
Yes, so no, you do not need to be employed by University Hospitals of Leicester. However, you need to be aware that this is a Leicester-based programme, and as a result, you need to be here physically. If you are very far away, you might have to move. Is this something you want to do? It's not a distance learning programme. It involves some active attendance, training, placements, cohort building activities. So no, you don't need to be here, and you don't need to be employed by University Hospitals of Leicester, but there is that other consideration still to take into account. I hope that answers this. Would you add anything else, Sally or Claire?
No, I think it's really important because they are clinical academic roles. Sorry, they're clinical projects, so they're not distance learning projects. So the projects would be integrated into either primary or secondary care across, you know, Leicester and Leicestershire. So it is important that you are absolutely here. There are usually bits that you can do remotely, but not consistently. And also, the other important thing, Sylvie, isn't it, is this cohort building, that, you know, that behind this doctoral training programme is a lot of cohort building activity. So it's really important that you become part of the doctoral training programme and not only engage, you know, from a research perspective, but also with your PhD fellows as well, to get the most out of your experience.
I think that's pretty much what needs to be considered. The next question is, would you recommend including submitting conference abstract in the CV?
I guess the simple answer to that is yes. So you're trying to show, you know, that you've been actively seeking out opportunities and you're interested and engaged in your clinical area, and that you wanting to, you know, present that work. So I'm not quite sure the exact question, but I think yes, if you've got a conference abstract and it's been accepted, that, you know, is a good thing to put on a CV. If your question is, if I've submitted a conference abstract and it's not been accepted, should I put that on my CV? I guess you have to put the best you have on your CV. So, you know, we don't all get things accepted, you know, whatever level we're at, we get lots of no's and rejections. So if you're still showing that engagement, that you're trying to submit these things and you don't have published things, then yes, you know, that would be a reasonable thing to add to a CV.
Thank you, Claire. Another question, what's the best way to find out about research projects you could get involved in, from Jennifer?
I guess it'd be useful. Sorry, yeah, I was just going to say it'd be useful to understand whether that's from a welcome DTP perspective, and I think we've sort of answered that in terms of when it's going to be, the process is going to be advertised, and there'll be some clarity then around the range of projects that we've put out and selected as the top ones. But then I guess it's the other interpretation of that question is, how might you get involved in research projects locally? And I think that, you know, Claire made a great suggestion that, you know, if you're doing it to bolster your CV, then opinion pieces are a great way of doing that. I think that if you're in a research active institution, you may wish to sidle up to somebody and ask if you can help with data collection or be involved in their projects. Within a year, if we're looking at the application process for next year, in all honesty, it'd be very difficult for you to set up your own project, in terms of getting ethics approval, conducting it and writing it up. So I think that's a big ask. I think the best thing to do is look at this idea of, service improvements or data collection from within your service, and then you show an appetite for service improvement, data handling, potentially presentations at a conference. So I would recommend that you perhaps in the short term do that, unless you're lucky enough to already work in a research active institution and can find someone that might be willing to support you. Claire, do you have anything to add to that?
No, I think you've said all the relevant things there, Sally. I was just looking at the other questions that were coming up in the chat as you were speaking, actually, and somebody's asked whether we only enroll one student per project, and the answer is yes to that. I mean, there are several projects, there's a range of projects, but it is only one PhD candidate per project. And I don't know whether, Sylvie, you want to answer this. Do we only employ the BAME students, which is an interesting question. I don't know if you want to reply to that one.
Yes, so no, we absolutely do not. We do not focus on recruiting any particular ethnic minority or ethnicity or gender or age or anything. Anybody who fulfills the requirements can apply, and it is absolutely not a decisive point in recruitment to where you're from or anything like that. It's that's not at all the case here. And yeah, please don't feel discouraged because of it's in fact, it's the opposite. We would like to encourage as wide an array of candidates, especially people who, might for whatever reason feel disadvantaged in applying for a research postgraduate fellowship. It's not, your ethnic background is not a decisive factor at all. Yeah. Another question. It was not easy to apply for more than one project. How can we improve the process next year? I don't know. Sorry, Claire. Claire?
Okay. Firstly, it's not essential, it's not mandatory that you apply for more than one project. We were just giving people an opportunity to apply for more than one project, should they have interest, in multiple projects. So some people apply, and if that project had already been aligned to somebody else at interview, then we would ask the candidates whether they were happy or willing to move on to an alternative project. Other candidates had interest in more than one project, so applied for a maximum of 2 projects. So this wasn't a mandatory requirement, and it's up to the individual to decide how their skills, experience, and desire to do research fits with the projects advertised.
Okay.
I think it's probably fair to say, Sylvia, I was just going to say, that there are lots of things that we've considered over this short period of time in terms of our processes, and there are things that we will undoubtedly change. So we will add that to the list of comments, just to make it very clear on the application form which projects you would be interested in. I think we had first and second choice on the form currently, didn't we? But we wouldn't have expected anyone to make 2 discrete applications, but simply identify their first and second. But perhaps we need first, second, third, and fourth.
Okay. So yeah, we've run out of questions, and we are running out of time. So I think we'll close here. Thank you very much to you all for coming and for asking interesting questions. Thank you to Sally and Claire for your presentations and for answering the questions. Oh gosh, sorry. One final question, real quick, just to answer this one. Are GPs part of the target group of prospective fellows? Sally, Claire, would you like to just answer this last one? Final question.
Yeah, they absolutely are, and that's very clear in the application form. It was very clear in the application form to welcome. So I did mention that in my presentation, that the target audience is nurses, midwives and AHPs and junior doctors, and they may be both in primary care and be GP trainee or in secondary care. So yes, absolutely included. We have no quota for any profession, and Welcome have guided us to simply recruit the best students, you know, that performed well on the day and had the strongest applications. So and that's not linked to any quota, but general practitioners are absolutely part of our inclusion criteria.
Okay, so that was the final question. Thank you very much. Thank you for the questions. Thank you to Sally and Claire. Thank you to Sophie, who was producing for us today, and Thomas for being here for support as well. And as mentioned before, this recording, an edited version of this, will be available on our website. So you can come back to this advice and review it and think about it. And, you know, if you come up with more questions, always email us. And I will always try and guide you and help you and to find out for you if you have any questions or worries or doubts or concerns. So yes, so thank you very much, and yes, goodbye.